Akiaria hindi igongona ria kuhingura thibitari ya Nanyuki Cottage, gavana wa Laikipia Joshua Irungu ni ahinyiriirie bata wa ngwataniro gatagati ka ene thibitari cia andu kiumbe na thibitari cia muingi kaunti-ini ino niguo gutigirira aikari ni maramukira motungata ma urigitani uria kwagiriire.
There are so many people, not only Laikipians, even the Samburu, the Ebu, the Meru, the Nyeri, and other people would want to seek services. And therefore, for me, this again gives us a benchmark.
Mugaru na thibitari nyingi cia muingi kuria mamwe ma motungata matangioneka. Irungu augite thibitari nyingi cia andu kiumbe cikoragwo na mashini hamwe na mweke wa motungata ta guthinja arwaru a mirimu ngurani. Akiendekithia marigitari honge-ini cieri kunyitanagira niguo kwadandura utaramu wao.
You have experiences, you have advanced skills that probably it's inadequate in our people. And therefore, I would be calling for that synergy that you can share whether some of the complicated operations, surgeries, those operations, if there are some of them complicated, let's get some of our surgeons coming over and learn together. And when they are doing this operation, my people, my staff will be enhanced in terms of the skill, not because of anything else, just because of good and quality service that they end up giving to our people of Kenya.
What we are going to do is we're going to work together on developing new specialities for which people go out of this county to Nairobi and other places. Why don't we bring all the specialists and super specialists in the county, work together, train our medical staff, train our clinical staff, train all those doctors and provide those specialty services in the county. So that is a plan which we have with the governor, and we are working together towards this partnership.
Kuhingurwo gwa thibitari wa Nanyuki Cottage gutanyitwo kwambatiria gikiro kia motungata nao arwaru riu makigia na mweke wa gucagura kuria mundu ekurigitirwo.
That the rates that of outpatient here is 500 shillings or reduced, and therefore for me I don't see it more of a private, but I see as another arm of the government giving the same medical services and good health to our people. And that's how I look at it.
We are focusing towards more specialty care and improving the quality of care which is provided now, which otherwise is not available and people mostly go out of the county.
Hadwini Hakameme TV, Titagugena, Wawaduru.